Welcome. I'm Jim Sluss. I'm the interim president of OU-Tulsa, and I'm pleased to be your master of ceremonies today. We're thrilled to be here today to celebrate the Giving Access and Gaining Knowledge campaign for the OU Bedlam Clinics. And as you are about to hear from many of our fine speakers, the Bedlam Clinics are a core part of the education for our medical professionals and social work students, and an amazing service to our community. The Bedlam Clinics are a true institution at OU-Tulsa, and the support of our generous donors allows us to provide this wonderful educational experience along with direct patient care. The Bedlam Clinics provide more than 3,200 patient visits annually. Pretty amazing. We have a very strong lineup of speakers here today, and I will introduce them as they come to the podium. But at this time, I'd like to recognize two of the dignitaries we have with us today. First, Dr. Gary Raskob, Provost of the OU Health Sciences Center campus. Thank you for being here. And Ms. Amy Noah, Vice President and Chief Advancement Officer for the OU Foundation. Amy, thank you for being here. At OU-Tulsa, yes. At OU-Tulsa, we're very fortunate to have Dr. James Herman serve as Dean of the OU-TU School of Community Medicine. He's starting his 8th year as Dean and also serves as the Morningcrest Professor of Family and Community Medicine. He's an emeritus professor and former chair of Family and Community Medicine at Penn State, and under his leadership, students, residents, and family physicians work to address the health disparities in our community and focus on the health of our entire population for the betterment of all. Please join me in welcoming Dean Herman.
Welcome, everybody. When I ask our students, both our medical students and our PA students, what's the best part about doing your studies here at OU-Tulsa, they invariably say the experience in the Bedlam Clinic. It's what makes us special, it's what makes us unique, and you're going to hear from some of them today that tell you about that. But before I get into that, some of the facts that you may already know. According to the United Health Foundation's 2021 America's Health Rankings report, Oklahoma ranks 44th in the nation for poor health. And more specifically, 14.3% of individuals in the state have diabetes, and 36.4%, to be precise, are obese. Only adding to those dire health outcomes is the reality that Oklahoma has the second highest uninsured rate in the nation, with 14.2% having no form of health insurance. And almost 20 years ago, we at the School of Community Medicine recognized a critical gap in access to health care for low-income individuals who do not qualify for Medicaid or other insurance. It's important to realize that many of these individuals are hardworking, but are still among the 1 in 6 Oklahomans living in poverty. In an effort to address this need, while also providing a hands-on, innovative student learning experience, the OU School of Community Medicine launched the OU Bedlam Clinics in 2003, as I said. The OU Bedlam Clinic Network serves uninsured citizens in the Tulsa area, and services are provided at no cost to the patient, including lab, radiology, and in many cases, pharmaceutical services. Due to a lack of resources, many of these individuals are not able to access the most basic healthcare services, and ultimately, unaddressed medical needs culminate into more critical health issues that can require costly hospitalization or emergency room visits. I've worked there myself. I've seen this time and time again. The average cost of a Bedlam visit is $250, give or take, and the average cost of an emergency room visit is $1,500. The Bedlam Clinic fits perfectly into our School of Community Medicine's 4-year curriculum in community medicine. We're part of OU's College of Medicine. We're a separate track in community medicine, and our curriculum integrates some interesting medical school pieces, including lifestyle medicine, culinary medicine, and others, things that you would have a hard time finding in a lot of medical school curricula. When I went to medical school, for example, we spent 0% of our time on nutrition. Our medical students are taught how to not only advise their patients about nutrition, but how to teach them how to cook the right foods. Fascinating. Under the aegis of a faculty chef. The centerpiece, as I said, of this entire curriculum in community medicine is the Bedlam Clinic. It's the cornerstone. It provides a unique learning experience. Third-year students are tasked with providing care for patients under faculty guidance, and it is here that they begin to learn what it's really like to take care of entire human beings with real problems. So we have medical students and PA students who are just starting out and moving from book learning to clinical learning and figuring out everything that they have to learn in order to do a good job. And we have a group of patients who are very grateful for that care. And when you light those up in those two directions, it creates a very magical space for learning and for care that we call Bedlam. Our patients are grateful to be receiving university-level quality care, because without it, the reality is many of them would have to go to the emergency room. We have episodic care happening 2 evenings a week, and we have longitudinal care for patients with chronic illnesses where they can come again and again and see the same doctor. By the way, it's a great thing for a medical student to be able to see the same patient twice in their medical school career. Doesn't always happen. And when the patient recognizes them, you get this communication like, oh, here's my doctor, which really helps our medical students learn about responsibility. We provide urgent care, continuous care, as I said, for chronic conditions, pharmacy services. We even provide access to some specialty health services through the Medical Access Program for qualifying patients. And I want to be sure to say that even with Medicaid expansion, there's still a need for Bedlam Clinics to continue to provide service in our community, because there are still working poor and people who are not covered who need this care. And we see this again and again. Oftentimes our students see someone in our episodic clinic, and then they continue to see them through the longitudinal clinic. So I'd like to take a moment to recognize our Bedlam Clinic staff and physicians who are here today. They work tirelessly to make sure this happens and to enable me to be to get up here and tell you about it. We have Dr. Monty Kavanaugh, who is our chair of family and community medicine. That's the department that oversees the Bedlam Clinics. Molly Lewis, nurse practitioner. Molly, thank you. Kim Crosby, the pharmacist. Kim is there. Dr. Janelle Witt, who's our medical director. Don't know. Katie Hartness, the clinical manager. Emma Keens, the interim assistant dean for College for Nursing Programs, because we have nursing students with us as well. And I'd say their experience is very similar to what I've described for the medicine and PA students, because we've often talked together about what that's like. And Gina Massey, director of social work services, who are also present. So thank you all for everything you do every day for Bedlam, and thank you all for being here today. Much appreciated.
Thank you, Dean Herman. Now we're going to hear from David Molina, a Bedlam Clinic patient. And David will be joined by third-year medical student Diego Lovano. Please join me in welcoming David and Diego.
Antes que nada, buenos días a todos. Mi nombre es David Molina.
Before anything, I would like to say good morning to everyone. My name is David Molina.
Quería pues platicar un poco de lo de que Bedlam ha sido para mí, ha sido una gran ayuda. Desgraciadamente yo tengo varias enfermedades. Una de ellas es el diabetes.
I just want to relate to all of you the great help the Bedlam Clinic has been to me. I unfortunately deal with many conditions, one of them being diabetes.
Y he padecido de un dolor en el estómago por mucho tiempo.
I've actually dealt with some stomach issues for a very long time.
Y la clínica me ha ofrecido mucha ayuda, y sobre de eso fue que me encontraron otras enfermedades por los estudios que la clínica me ha ofrecido.
And thanks to the immense help I received from the clinic, they were able to detect can help me deal with all these issues.
Entonces yo pienso, yo estoy bien agradecido con la clínica y creo que hay muchísima gente allá afuera como yo que necesita la ayuda y la clínica ofrece esa ayuda.
I can't tell you how thankful I am for the clinic. There's a lot of people out there just like me who this clinic benefits immensely.
Y pues de nuevo, gracias a Bedlam. Sin la ayuda de ustedes, los donadores o la gente que hace posible esto, pues no sería posible de que la gente como yo reciban la ayuda que necesitan.
And I just want to reiterate my thanks and gratitude to everyone, to donors, to everybody who works there. Because without your help, people like me would not be able to receive the help they need.
Bedlam es un recurso invaluable para todos los miembros del programa.
Bedlam is an invaluable resource for every member of the program.
En pocas palabras, yo pienso que es una de las mejores ayudas que hay allá, porque como les digo de nuevo, habemos muchos allá afuera que no tenemos los recursos para hacer estudios y pagar los medicamentos, y gracias a este programa yo estoy recibiendo la mejor ayuda que hay.
In short, this is an invaluable resource for people like me who without this help would not be able to find the resources to be able to take care of my own health.
Y pues de nuevo, gracias a Bedlam y a todos los que lo hacen posible.
Once again, thank you, and thank you to everyone that makes Bedlam's clinics possible.
Thank you, David and Diego. Our next speaker is fourth-year medical student Madeline Lyons. Originally from Seattle, she came to Tulsa for her undergraduate education at TU, where she was on the rowing team. She built a community here and decided to stay for medical school. Community medicine is her passion, so the School of Community Medicine is a perfect fit for her. Please join me in welcoming Madeline Lyons.
So in my first week of my third year of medical school, I walked into Bedlam Clinic, was assigned a list of patients, and was told, these are your patients now, have fun. I had been seeing some patients already on my rotations. I had worked as a medical scribe for a time, I'd done some shadowing, we had done a lot of practice patient encounters in our clinical medicine classes, so I thought, I got this. I kind of have a handle on how to run a basic outpatient office visit. Well, boy, was I wrong. Let me tell you, there is nothing more humbling than being the primary provider in your patient's care for the first time and realizing once and for all just how difficult it is. So being the person running point on the office visit is vastly different from being the little sidekick who goes in and sees the patient and then reports to the real doctor afterward, and they kind of take it from there. Being in charge, if you will, honed my medical decision-making skills, my time management skills, and my people skills. Bedlam Clinic also helped me to be a real doctor by understanding that nothing magically happens. So if I want a patient to get labs drawn, I need to order the labs, I need to call the patient and make sure that they're actually coming in and getting those drawn. I need to follow up on the results and interpret those, and then later I need to use that information to actually make changes to my patient's care, adjusting medications or changing our treatment plan. Being responsible for every step of the process really demanded more sophisticated problem solving and decision making compared to, the structure of other rotations where sometimes I would only see the patient for a single 30-minute slice of time. I will always be thankful to the Bedlam program for allowing me to develop close relationships with all of my patients. I call all of my patients my favorites, but I really do have a favorite, and her name is Mary. And she's hilarious and friendly and funny, and we have such a great time when she comes in to see me, or when she came in to see me. Mary has dozens of medical problems, all of which are difficult to manage. She also spends most of her time, taking care of other people, managing her household, and she has a lot of financial strain, so that makes it difficult, understandably, for her to prioritize her health. Despite all of these challenges, Mary never missed an appointment with me, and we made some incredible progress together throughout the year. In December of last year, we did some strategizing together, and she ended up buying a pill organizer and started taking every single one of her meds every single day. Together, we made a plan and got her up to date on all of her cancer screenings. She got her hypothyroidism under control, her blood pressure under control, her asthma under better control. We switched her mental health medication and got her mental health to a functional level for the first time in years, and she also lost about 20 pounds. I cannot give Mary enough credit for the incredible changes that she made over the course of our year together in truly transforming her health. Because of Bedlam, I was able to witness this health transformation during our frequent follow-up visits. This was not only a benefit to my learning, but having one dedicated provider who knew Mary allowed her to build trust with somebody and have time to make a plan that she was comfortable with for prioritizing her health problems. So it's obvious that Bedlam Clinic is a huge benefit to the students in our learning, but really it is also a major advantage to our patients. Through this program, uninsured patients are able to get free medication, office visits without a single copay, free lab work and cancer screenings, many free referrals to much needed specialists, and so much more. Patients are also able to take part in our food pharmacy, which not only provides them with fresh produce every single Tuesday, but also sets them up by stocking their pantry with dry goods and canned goods, and then giving them a kit of cooking materials, cutting boards, a chef knife, a pan, so that they're able to actually make meals at home with the food that they're getting. My patient Mary, who I was telling you about, she got produce from the food pharmacy every single week, and when she came in to see me, she would tell me about what random vegetables she'd been given, what she'd been able to do with them, and like Dean Herman was saying, we were able to actually talk about nutrition, and we were able to swap recipes, and it was a really cool experience. Bedlam Clinic has truly been a life-changing experience for those involved. It is set up first and foremost to take care of our patients in our community, but it also has played a huge role in my medical education. I'm going to be a pediatrician, which I'm very excited for. So I won't be practicing adult medicine anymore, but the education that I received in Bedlam will transfer to truly every single area of medicine, from surgical subspecialty fields to neonatology to outpatient internal medicine. I know I will be a better doctor because of the experiences that I was able to have in Bedlam. I'm so grateful to our donors for making Bedlam possible, for creating such a vital part of my medical education while helping the people who need it most in our community. You have no idea what your donations mean to our learning and to the real lives of our patients. Thank you.
Thank you, Madeline. Students like you are the real reason that we do what we do, and we look forward to celebrating your successes. It's now my pleasure to introduce the president of the University of Oklahoma, Joseph Harris Jr. He served the university for over 25 years now in a variety of leadership roles and was named the 15th president of OU in May 2020. Please join me in welcoming President Joseph Harris Jr.
Thank you. I've been up here quite a bit in this room, seeing a lot of the faces that are looking at me like, we know your shtick. I think that's a terrific thing. I really do. They've given me a very structured set of talking points, which I'll follow at some point. But we're here for the Bedlam Clinics, but we are here again. And I think that's what's so important. When we think about what a university can do, when we think about what our obligation is, I've been involved with the university for the last 25 years. And our ability to meet the needs of what's taking place in Tulsa, in Northeast Oklahoma, has not in any way been fully realized. And I think that's a kind characterization. When we look at the leadership that's here today, and I want to thank President Sluss for the work that he's doing, and Dean Herman, who's been working tirelessly to make sure that we can fully realize what we can be here. And Gary Raskob, who was recently made the permanent provost of the Health Sciences Center, and his leadership. When you look at what's taking place here, it is moving towards that full fulfillment of what we can do to help, what we can do to provide, what we can do that's our obligation to be a part of it. And when you listen to David Molina, right, and you listen to Madeline, we had no idea you were nervous until you sat down, right? I mean, this is, when you look at what the Bedlams do for our community, it's essential. This community, Northeast Oklahoma and Tulsa specifically, it's different. The engagement of the community itself, the involvement of the philanthropic community, and the opportunities that are created to advance the lives of people is stunning and important, and we are fully committed to that. And we think about what a research university does, a flagship research university. It is to provide patient care, right? It is to teach, it is to do research, and it is to serve. And we look around, we see the full embodiment of that in the clinics that are taking place. The Bedlam Clinic being, I believe, the longest serving of those that's here. The numbers are staggering. You heard at least one of them, but I'll repeat these numbers just again. The annual statistics for the Bedlam Clinic, 3,200 patient visits a year, right? 3,200 patient visits a year, 11,000 no-cost prescriptions filled, almost 12,000 hours of student learning, 660 patients visit with social workers, and there are more than 500 behavioral screenings, right? So it's the full integration of the healthcare specialties to treat the person as a whole. Right? As we look at what's taking place and what we're doing now to hopefully more fully realize what OU can do as a part of this state and as a part of Northeast Oklahoma, there have been some other announcements that are here, that have been here that I've talked about. Most recently, we opened up the 18 operatories for the College of Dentistry and expanded those here. Right? Over a third of the patients that couldn't afford dental care were driving from this area right down to Oklahoma City, which means so many were not being served. Over a third of the patients that are at the Bedlam Clinic itself, right, do it at no cost. Right? They wouldn't otherwise receive health care except possibly much later in an emergency room. So when we look at this, we have a commitment that is now the OU Polytech Institute that we're bringing to Tulsa that will be a huge contribution to the community. We're also working on bringing Stevenson Cancer Center to Tulsa. When you look at the healthcare outcomes that come when you are a cancer patient that goes to Stevenson, right? The only NCI designated cancer center in Oklahoma, and some states don't have any at all. The chances for your survival rate go up 25%. And now think about that. 1 in 2 men in Oklahoma will be diagnosed with cancer. 1 in 3 women will be diagnosed with cancer. And 1/3 of those individuals who receive that diagnosis will die from the disease. And yet, when you look at those, and 1 in 5 Oklahomans, 1 in 5.5 Oklahomans that receive that diagnosis go to Stevenson to receive their cancer treatment. Yet, Stevenson Cancer has only been in Oklahoma City. And less than 2% of the patients that go to Stevenson are from Northeast Oklahoma. Right? And the level of care is simply different, and it's statistically provable. Academic physicians and the discipline behind that provide a different level of care. And so as we sit here and we are fully committed to being in Northeast Oklahoma, we are talking about expanding our classes to make sure we meet the needs of Oklahoma. Being in those mid-40s in terms of healthcare outcomes is beyond unacceptable. Nobody can prosper in any aspect of their life when their healthcare needs are not being met. It's just not possible. And so we sit here today and talk about what these Bedlam clinics are, right? They're not just about the individuals that otherwise wouldn't receive care, and they're not just about the students who need that training to become better physicians and providers of healthcare. Right? It's about who we are as a people. It's about who we are as a community, who we are as a state. Right? It could not be more important. Right? There's nothing more important that we do. And we're unbelievably proud of it. So there was a campaign that was started called Giving Access and Gaining Knowledge, and it's one of the reasons that we're here right now. The goal of this campaign was to provide $7 million, an endowment that would allow for the continuation and the support of the Bedlam Clinic. So the way it's being funded right now, right, it's taking from here and there, right? It's relying upon every year, can we find the resources we need to make sure we can do it again next year, next month. And there are donors who have made annual contributions that are remarkable. Ascension St. John, the Ida McFarland Memorial Trust. There are a lot of individuals that have been a huge part of this. And so this campaign for $7 million, right, was a visionary effort to say we're not going to try and just take money each month, each year, and fund this internally. And by the way, by doing that, right, we don't know if we can provide care on the next month or the next year, and we also take away from those dollars that could go to additional academic enterprises, the focus of what we're doing. And so as we stand here today, we're at a unique moment, which is to say, can we realize that gift? When we walk through how this is funded right now, the one group that has stepped up time and time again is the Oxley Foundation. It's stunning what they've done, and I want to walk through what they've done. Towards this $7 million, they saw this and they said, we're going to give $3.5 million. And we want that matched by others in the community to see if we can find that $7 million that is so desperately needed. Now, it's times like these when all of us have heard about the Oxley Foundation, and I want to say just a few things about it to make sure we're all centered on who and where this came from, because it's the essence of community. John T. and Mary Kay Oxley were obviously Tulsans. John was a successful entrepreneur at universities. We love those types, right? And he rose to the ranks of Warren Petroleum before launching two companies of his own, Texas Natural Gasoline Corporation and Oxley Petroleum. The couple had a remarkable life, and they had three incredible children, in John C., Mary Jane, and Thomas. In 1985, they decided to give back in a wholesale fashion and created the Oxley Foundation. And their gifts are remarkable and life-changing in every sense. The gifts from the Oxley Foundation to the OU-TU School of Community Medicine have been stunning. They're now at over $17 million. And when you look at what they've done, we wouldn't be here without them. I mean, it's just that simple. 5 endowed chairs in the Department of Psychiatry, which is $1 million value, plus then estate matching of $1 million each for those. When we wanted to establish the OU-TU School of Community Medicine, it wouldn't have happened without a $5 million gift from the Oxley Foundation. And then there was a $6.5 million gift to establish the endowment for the Mary Kay and John T. Oxley School of Community Medicine Scholarship Program, which provides scholarship support to medical students and PA students, right? Opportunities that otherwise wouldn't be there. And so they've made this $3.5 million challenge to raise $7 million total, and we're almost there, right? On that matching gift right now, as of right now, we have $3.142 million, right? Absolutely. I think that's absolutely applause. And we're not leaving this room until we pick up the rest. So that's the tricky part of this announcement. Doors have been locked. The fire marshal's ours. So it's all going to work out great. I do want to thank some people, and there are so many folks that need to be thanked. Let me introduce them in two groups. I'll give you their names, and then let's do the applause in the two groups. I wish we could spend more time on each of them, thanking them. But certainly key donors that we want to recognize right now, and I'd ask that you stand. That whole thing where you weren't standing before when you were introduced, it's not going to work. Let's go ahead and stand. Let's begin with Tracy and Troy Gudgel and Joyce Wolf from the Oxley Family Foundation. Greg Foland from the Morning Crest Healthcare Foundation. Amanda Morrell from the Cortez Family Foundation. Michael DuPont from the Charles and Lynn Schusterman Family Philanthropies. And Mary Coates, as Mary Coates. There are so many that couldn't join us, but thank you all for joining us, and thank you for everything that you're doing and have done. We also had 81 total donors so far that have already given towards this number, towards the $3.14 million that is going towards that $3.5 million challenge grant. And this is what's stunning, and not surprising, but it's incredibly heartwarming. 20 of those gifts have come from current or former faculty here on this campus, and as if they don't give enough. And they've done that. I want to introduce them as a group and ask that they stand, and we'll hold our applause until the end. But I do want to recognize them. Dr. James Herman, Dr. Michael Weiss. That's right. Oh, already standing. That could have taken a while. Thanks for stopping that. Because I was going to shame until the standing occurred. Dr. Monty Kavanaugh, also standing. Dr. Audrey Corbett. Dr. Saisha Dennis. The donors are all standing. Dr. Andrea Gleason, who I assume is standing. Dr. Jean Hayes. Let's give them a round of applause. Like I said, I could go on and on, but you all have heard a lot from me. And here's the good news. You're going to hear more from me in the coming weeks and months, right? Including at the end of this event when we announce that we've realized the full $3.5 million match. Hey, this is, the perspective of the patient and the student and the administration. What's happening here is special, and it fundamentally matters in the lives of everyone. And Dr. Nelson earlier walked up and said, we know you're going to say that we change lives, which is, of course, the purpose of the university as a whole. But as we've seen here today, and because of these gifts, as we'll see through an endowment that is permanent, because of you all, we are changing lives, and we're incredibly grateful. Thank you.
Thank you, President Harris. We appreciate you being here today to help us thank the donors who make the work of the Bedlam Clinics possible for our students and the patients who need it the most. Thanks to all of you for being here today, and please feel free to speak with any of our advancement staff who are present if you'd like to support this very worthwhile campaign. Have a wonderful day.